Okay. Hello, good afternoon, everyone. Welcome to Baby Chakra. I, Dr. Jagriti Anand Sharma, is a dental surgeon. I am practicing at my own private dental clinic by name Shivam Dental Clinic in Moti Nagar, Lucknow. I am practicing as a dentist since 2 years. So today we are going to discuss 5 ways of preventing gum disease in kids. First of all, we must introduce good oral hygiene habits in our kids. Brushing, which is the key, make your kids brush at least twice a day. Secondly, is flossing. Give them a dental floss, teach them, model them how to use a floss in the interdental area so that there will be least chances of gum infections. Thirdly, use a mouthwash at least once a day. Introduce mouthwashes that has antimicrobial properties. Fourth, you can basically this is very important to introduce nutritious diet, giving them a nutritious diet, balanced diet, drinking plenty of water, avoiding some junk foods. And the fifth is visiting your dentist or a dental hygienist at least once a year or in 6 months. So these are the 5 points in which we can prevent our kids' teeth from gum diseases. So, uh, question is, what everyday habits can help to prevent gum disease in kids? So, first of all, you have to start with good oral habits early. Like when your kids' teeth start erupting, from that day only start. Nowadays, we have infant toothbrush. So, introduce brushing since then only. And as your kids grow, you can use a fluoride toothpaste. Like for a 2-year-old child, you can use a rice grain amount toothpaste and teach them or model them how to brush. They should brush their teeth very gently. Like I can model you. You should brush your teeth circular motions gently at an 45-degree angle so that any of the food particles that stucks between the two teeth gets removed easily. And if you like brush very vigorously, the outer layer of the teeth, which is the enamel, which protects the acids and all to come in between, so this gets ripped off when you vigorously brush your teeth. So tell them how you have to brush slowly, gently, and at an angle of 45-degree. Secondly, they should get enough fluoride. You can use fluorinated toothpaste. Tell them brush wisely using a good fluorinated toothpaste that has ADA specification seal on it. Thirdly, you can avoid some foods like sugary, sticky foods, sticky candies. Nowadays, we have gummy vitamin candies. So avoid those candies that can erode your enamel. It will cause cavities also, and it will give you problem to your gums also. And you can go for like regular cleaning to your dentist if you find any signs of gingivitis, that is swollen gums, bleeding gums. You can go to a dentist and they can plan a scaling or root planing, in which all the plaque which has deposited or built up on your tooth surface, it is cleaned. Okay, what's next question? What factors contribute to gum diseases in kids? See, the main factor that will cause gum diseases is the building of the plaque on the tooth is the main cause for these gum diseases. When you're not brushing your teeth properly, the plaque is getting accumulated on the teeth, and if you're not flossing, the infection is causing it between the interdental areas. So other factors like food which stucks in the gums, if you are giving your child some sticky food, gummy candies, some children have habit of mouth breathing, because of which the mouth gets dry and the chances of this accumulation of plaque increases. Some children are not having proper nutrition, their diet is not proper, so that are the factors which can contribute. Other is maintaining poor oral hygiene. Some parents are not taking care or not teaching them, so the child is not maintaining proper oral hygiene, not brushing the teeth twice, not avoiding junk foods. There can be factors like in some children you can see that there is a habit of clenching or grinding of teeth, which we call bruxism. Due to this, there is a reason which can be caused, and there are certain medicines also which can cause an outgrowth of gums, so which can cause an overgrowth on gums. These are the factors that contribute to gum diseases in kids. Yes, next question. Does flavored toothpaste worsen gum diseases in kids? See, like for maintaining a routine in your kids for brushing, nowadays we have very flavored toothpaste so that it can come in child routine easily. They can maintain this habit easily. So there are many flavored toothpaste. But yes, these toothpaste they worsen your gum diseases because uh, there is present SLS, sodium lauryl sulfate, which causes irritation in gums. So avoid SLS toothpaste, the toothpaste which has sodium lauryl sulfate, because if you have swollen gums, this will cause irritation in your gums. So prefer you use non-flavored toothpaste for your kids, which has good amount of fluoride. So the teeth gets fluoride, and it can protect your enamel from acidic acids, that acidic acids which erode, because when you use flavored toothpaste it can also sometimes cause a burning sensation in your mouth. There are conditions that have been seen. Okay, the next question is, what food should I avoid when my kid is suffering from a gum infection? So the foods which you need to avoid is, first of all, acidic juices and fruits. Acidic juices will cause more erosion to your enamel, and your child will get more gum infection. Also candies, avoid candies totally because they are sticky, they'll stick to your gums and they'll cause severe gum problems. You can also avoid soda and sports drink because they contain acid and sugar, which is not good for gum infections. Also avoid tea and coffee or any caffeinated products because they are very bad for gums. They will cause dry mouth. And also nowadays these children are very lovable for popcorn, so you can avoid popcorn also, that it does not get into your interdental areas, because if you're stuck into your interdental areas it will cause more problem. So watch home care is needed to support recovery from gum infections and gum bleeding in my 7-year-old. So you can first of all maintain or practice good oral hygiene from early only, as I suggested you. Also make a habit, if there is a gum infection, take half spoon of salt, 1 glass of warm water, add that half spoon in one glass of warm water, and tell to rinse it for a few seconds. Use this technique like for 3 to 4 times a day. This will reduce the swelling of the gums. Also it will stop bleeding. You can rinse your mouth with hydrogen peroxide after brushing. Take good intake of vitamin C foods like oranges, sweet potato, carrots. You can also reduce carbohydrates because carbohydrates intake can also increase this gums problem. And rinse with saline water, as I told you, which we can do for home. All I would say is ki just from the beginning, like takeaway message I would give to everyone, like from beginning teach your children to maintain a good oral hygiene. Keep these points in mind. Good brushing twice a day, flossing is the key, using a mouthwash, eating a balanced diet, and visiting a dentist at least once a year. Just take care of teeth. And thank you, Baby Chakra, for having me with you. It was a good question, and I had a good session. And if you have any of the questions regarding your teeth or any gum diseases, you can like DM me at my Insta ID, Dr. Jagriti Anand Sharma, or I have a clinic page, Shivam Dental Clinic. You can follow me on Instagram. Also, other related things you can get about me on Baby Chakra. Thank you. You can follow me on Baby Chakra. Thank you, everyone.